Nicholas Waters talking to us about Canada. And Nicholas Waters is Director of Access to Quality Mental Health Services at the Mental Health Commission of Canada. So it's at almost the other side of the world regarding that. But very interestingly, Nicholas is being responsible for e-mental health and notably also the implementation of new interventions there, increasing access, structural stigma, and development of tools and resources for healthcare providers. And the Commission of the Mental Health Commission Canada has developed, for instance, a very useful tool and a toolkit to indeed implement also those kinds of services. And interestingly, I think we can find ways to align the work that is being done in implemental and the work that's been done on tailored implementation and the approach that Canada has taken on this. So I'm very much looking forward to hear from Nicholas. Welcome, Nicholas. Thanks you're here. And you will be talking about innovation to implementation, e-mental health in Canada. So over to you.
Thank you very much for the introduction. Really pleased to be with everyone this morning. It's nice and early here in Canada and still a little bit dark outside. So I see some beautiful sunshine for where you are. So again, good morning. So my name is Nicholas Waters. I am the Director of the Access to Quality Mental Health Services team at the Mental Health Commission of Canada. I'd like to start by just saying a few disclosures. Of course, I am a proud Canadian. I do happen to love the wonderful sport of ice hockey. But like a lot of Canadians, I unfortunately don't like the cold and I don't like winter. And if I look outside and it's still dark and there's snow on the ground in March, I wish I was somewhere a bit warmer. I'm also not a researcher. I'm not a policymaker or specifically in a governmental role. I'm not a practitioner. But who I am and what I do is I work with all different stakeholders, including those with lived and living experience, to improve access to and the quality of mental health services and supports in Canada. And so really have the pleasure of working across the spectrum with many different diverse stakeholders and groups and organizations across Canada. I'll give you a bit of context from Canada, and these numbers are pre-COVID, and I'll talk a little bit more about some of the numbers that we've done some surveying on during COVID, but currently 1 in 5 Canadians will experience a mental health problem or illness within any given year, and that really correlates into 1 in 2 by the age of 40. But what we usually say in Canada is it's really 5 in 5 because every single person experiences mental health and mental health within their families, their workplaces, their friends. And so it's really impossible to find someone who isn't touched by mental health in some way, shape, or form. The cost of mental health, you can see on this slide, roughly by 2041 will cost the Canadian economy $307 billion. And you can see on the right-hand side that there's some comparators with, in terms of pure numbers with type 1 diabetes and heart disease. And this gives you an idea of the sheer volume of not only individuals, but the cost to the economy for Canadians. And unfortunately, those who have identified mental health problem or illness and are looking to get supports, still a large majority of them find that their need for services and care are not being met or only partially met. Another staggering statistic from Canada is that 500,000 Canadians are unable to work due to mental illness every week. And this isn't the same 500,000 people, it's a different 500,000 people every week. So when you take into account the economic burden and then also with the resource and human resources burden, it's just a large impact to society as a whole. And with that being said, even though we have 500,000 people missing work every week due to a mental illness, and we have billions of dollars to the economy, Canada still lags behind other countries in terms of mental health spending. So roughly 7.2% currently, as you can see as a comparator to England, around 13%. Our funding for mental health care is majority from the province, is funded by the provinces. So each province may spend a bit of a different amount, but this is an average of all the provinces and territories. So a bit about the MHCC. So we started back as a report that came out of a Senate committee, which was the largest study of mental health and mental illness in the country, called Out of the Shadows at Last. And the commission was set up as an arm's length organization that works with the federal government. We do receive a large portion of our funding from Health Canada, but we do receive funds from other areas, philanthropy, for-profit, the provinces and territories themselves. And so our funding is roughly about 60% from Health Canada and 40% from other areas. When we think about what the commission does, I'll talk about some of the specific areas, but some of the words that come to mind for people are trusted advisor, convener. We do training, we develop toolkits. We don't write policy itself, but we contribute to policy. We do primary research, but we often partner with other research institutions across Canada and internationally. And so what we really see is ourselves as a catalyst for change within the mental health system. And because we are an arm's length organization that works with Health Canada, but works directly with other stakeholders, it gives us the opportunity to be flexible and also start new work during times like COVID, when we have to change course quite quickly due to the changing environment. Just a bit of an idea of our first 10 years, we had 4 kind of key priority areas. The first was to develop a mental health strategy for Canada. We were the last G8 country without a mental health strategy. Happily, that was released now all the way back in 2012 and still guides the majority of our work today. We developed a Pan-Canadian Knowledge Exchange Center, and I was the director of that center for the last 7 years before becoming the director of our access team. And that work was really developing tools and resources to support implementation, and also looking at doing specific project work which helps advance the mental health strategy for Canada. The third area was our Opening Minds initiatives, which was tackling stigma and discrimination, specifically around self-stigma and interpersonal stigma. And then the last area that was added a bit later was our At-Home Chez Soi project, which was the largest research demonstration project on housing, first in the world at the time. And since 2017, when we started a new mandate, we are looking at a few different areas, the concurrent nature of substance use and addiction. We had started working in suicide prevention prior to 2017, but really became a key central focus of our work, doing that in partnership with many other organizations. We also work on what is priority populations, which is really looking not only at the populations themselves, but ensuring that services are delivered stigma-free and recovery-oriented. And then engagement, so that catalyst role, bringing people together to share knowledge and resources, to partner, and to figure out ways to improve services and limit some of the gaps into receiving services. And e-mental health is spread across all of these initiatives, and I'll start to speak about that in the next slide, or in upcoming slides. Just to give you an idea of the impact of the pandemic on Canadians, I mentioned some of those stats at the beginning. We did do some survey polling, and we've been doing it constantly in partnership with a few other organizations. And not surprisingly, I'm sure it is similar in your countries, that we're finding that since March 2020, people are indicating that their mental health has deteriorated. At about 40% of Canadian surveys said their mental health has deteriorated. We find that in particular populations, youth being even higher at 60%, Indigenous Canadians 54%, those who have disability also around 50%. And nearly half of all men, half of all women and 1/3 of all men have said their mental health has declined during the pandemic. And really telling stat, we have an organization called Kids Help Phone that works specifically with youth in Canada, and their request for services has gone up 137%. And their texting service alone has gone up by 58% in volume. So just huge shifts in numbers, with already people not being able to receive services and supports for various reasons, and the pandemic highlighting that and making that even more challenging. The Commission did some quick changes to our programming. We developed a policy team specifically looking at the impacts of COVID. We've developed many different training, taken our mental health first aid and our working mind, which is stigma reduction training, completely digitize that in a very short period of time. And we also have a COVID-19 resource hub, which can be found on the Mental Health Commission of Canada's website, that provides tools and resources for a wide variety of audiences, from caregivers to seniors to children and youth, which can be found on our site. So when we're talking about e-mental health at our organization, we're really talking about technology that is enhancing service delivery, and so, or service structure. And so it's not just about applications or online chats or chatbots. It's really the use of technology to enhance, again, the delivery or structure of services. I'm sure this probably resonates with others, but e-mental health has been something that's been growing in Canada for many years, but often was quite hard to get funding for, and also really showcase that e-services can be as effective as in-person services. And we would hear a lot of, nope, that's not the case, or that, you know, the funding wasn't there. But then all of a sudden, during the pandemic, we saw a pretty significant shift to the yes. And with that yes came some money. So this is Canadian money, for those who don't know. And, you know, that shift, I think, was for, you know, obviously the reason that people were at home, were needed to access services in a different way. And one of the largest initiatives that happened in Canada was something called Wellness Together Canada. So this is a website that any Canadian can access. It is free of cost, available 24/7, provides links to services and supports, counseling, psychotherapy. And this was something that the Government of Canada put together pretty much over a 6-week time period, with a few different key players. And so this is iteration 1. At this time, roughly mid-March, they've had just about 1,100,000 unique visitors to the website, and who have taken part in accessing this site. And we're hoping that in further stages, we'll look at user design, the flow of the site, making sure that there aren't barriers such as multiple sign-ins, because this does link to other online programs as well. But is a great example that is something that before the pandemic would be, you know, it would be something that we could have never dreamed of, to have a national website that's promoting e-mental health throughout Canada. A couple other projects that I wanted to highlight that the Commission is working in. I will do so in the next few slides. So many of you have probably heard of Stepped Care. Stepped Care 2.0 is a bit of a different model. It was developed by Dr. Peter Cornish as a way to organize and deliver evidence-based programming that aligns with recovery principles. We started this work back in 2017, and the reason I'm showing you a map is this is one of our largest provinces, Newfoundland and Labrador. And we tested a model, which you can see here, and which is really taking the traditional stepped care continuum and inserting e-mental health solutions within each step. So this is a model that's based on a single session methodology. So someone going in to get services will be seen that day and can choose different paths in terms of their journey. So they can choose the more traditional services, but they can also choose e-mental health solutions across the continuum, or a blended approach. And this is really about the partnership between the practitioner and the person that's accessing services, about what works for them. A few highlights from this is that what we found is that the majority of people accessing services really were only needing steps 1 and 2, and about 40% of the people that were coming in to services traditionally were using those e-solutions and not needing further care, which of course frees up more resources on the intensive scale of this stepped care model. And the other piece is that because of the shift in how the triaging works, wait times were reduced in that province alone in about a 2-year time period by 68%. So just a huge significant shift from the wait times that are often up to 12 months, 16 months, as high as 18 months to receive more specialized care. I mentioned that that was in this particular province, that it was 68%. And one of the biggest lessons in terms of implementation, this was only a 2-year project. We were doing system transformation in 2 years. And really the first year of this work was working with the practitioners to train them not only on the single session methodology, but also the e-mental health tools and resources. And so thinking about really the portion that was running in the clinics was probably just over a year. And the results were still a 68% reduction in wait times. We have now scaled this model to 2 other provinces, one province, Nova Scotia, and one territory, the Northwest Territories, but there's interest from across Canada because it's a blended approach that takes the best of the in-person, the best of online, and is 100% about choice. Christian mentioned that the Mental Health Commission of Canada also has a toolkit for e-mental health implementation. This was developed back in 2016, 2017, so it's actually been out for a few years now. And it has 5 modules as well. And they're structured that there's learning objectives, there's the content, there's case scenarios, there's activities within each module. And they're not meant to be done in a linear fashion. So each organization has a different is at a different stage of their implementation journey. So some organizations may only want to focus on engaging people with lived experience within their journeys. Some are newer to e-mental health, so we'll start right at the beginning. Within this, there is 12 appendices that have multiple checklists and tools and resources. And in current form, it is a paper document, so we're actually looking to digitize this module and have the toolkit and have each module be a standalone digital delivery. We have done training on this module, so we do in-person. When it wasn't the pandemic, we did in-person training with practitioners and their staff, and have had very positive feedback and results around implementing e-mental health when following this toolkit. And again, this will be digitized, and excited to share that when it is ready. One of the biggest challenges that we've faced, like other countries, is the evaluation of mental health apps and technologies. And I think COVID-19 has proved this to be even more important when people are looking on their phone, on their computer for self-help or for different resources for supports for their own mental health. But unfortunately, most of the tools and resources aren't evaluated, and those that are, often the evaluations are not strong. So we're undertaking a process in Canada to develop an accreditation and evaluation system for all mental health apps. We developed a 1-page, 2-pager a few years ago with our Canadian Institutes of Health Research, but that is still a pretty passive document that you would have to sit back and look at each category and do the evaluation yourself. Where what we're looking to do now is, in partnership with other organizations across the country, is develop a system that any Canadian can go online, by diagnosis and by ratings, can see what's the best apps for depression, what's the best apps for anxiety, evaluated, and give you your top criteria applications, removing the ones that wouldn't meet those baseline. We would also like a mirror image of this to be available for practitioners, so that when they're seeing patients, they can have the confidence to prescribe an app that is evidence-informed and is going to fit the need for their specific clients. So we're actually hosting an app forum on this work next week, and then in the next upcoming years, we'll be developing that platform. Just briefly on AI, I think we've done a lot of exploratory work in Canada around the use of artificial intelligence. A lot of that, of course, centers around chatbots and other machine-led learning devices. The challenges that we're finding is that is around the equity of the data itself. And so AI and machine learning, it can have such a powerful potential to enhance mental health systems, but if the data going into these systems isn't taking into account many different factors, then the interventions themselves will not be as strong. And so we're still doing a fair bit of work in this area, and would love to learn from other countries that might be a little bit further ahead. the last couple of things that I just wanted to highlight, because it's an important role that we play at the Commission, is we host many different events, but one in particular, we have an e-mental health collaborative, which is a collaborative of about 30 experts from across the country that come together to discuss research and policy and programmatic and implementation aspects as they relate to e-mental health. In that Wellness Together Canada portal that I mentioned, 3 of the members who made that portal happen were actually on the collaborative. So without those conversations and partnerships, we wouldn't have been able to scale up a national platform as quickly as we did. We're also connected in with an international e-mental health collaborative and host a conference every year. We just had ours. It's usually in person. This year it was online. We had about 750 participants. I would say that the conversations went from the possible to the actual. So we used to talk about all of the potential of e-mental health, and because of the shift of the pandemic, we're now talking about what's happening and talking about more around implementation and evaluation and partnerships. And the last thing that we're looking to undertake in the next couple of years is the development of an e-mental health strategy for Canada. There's 2 different fields of thought on the best approach to do this, one being a standalone document that outlines all of the necessary policies, programs, evaluation, et cetera, around developing strategy. And the other is to implement it within our national mental health strategy and using it as an enabler to enhance the vision of that strategy. So something that we'll be doing a lot of consultation on. Would also at some point love to reach out to this group to hear your thoughts and get your expertise on the best approach to do that. So with that, I have a slide that just has my email address and my Twitter handle. I joined Twitter really early, so I actually have my perfectly spelled name. Don't use it very often, but trying to get better. So if you'd like to reach out, there's 2 different ways. And so thank you for having me and allowing me to share a little bit of our journey in e-mental health in Canada.
So thanks very much, Nicholas. This is very inspiring in the sense that I think yesterday we had a lecture by Carl May also explaining or highlighting the different perspectives that you can have to, let's say, the implementation puzzle. And it's very interesting that you, with the Commission, Mental Health Commission in Canada, take this, I think, more of the macro perspective and really try to infuse and make changes all the way through into the real world practice in that sense, and bring that together. And I think I noted down partnerships, which is, I think, a very interesting concept, because in our work or in the It Fits work, we've been focusing on stakeholders, and I think we might think differently about that in terms of let's share responsibility and take up partnerships, even perhaps in the micro or the meso level in terms of implementing things. So thank you very much.